My husband and I were trying to have a baby, and we tried for 9.5 years. So we had infertility issues, and it was recommended to me finally to go to a fertility specialist, which I did. And when they did all my lab work, they noticed that my TSH and T4 were down really low. And so they said I had to go to an endocrinologist before I could start any more process of doing IVF. So my doctor recommended Dr. Hands to me and said that I needed to come see her, and she could look at my thyroid and see what I needed to do.
For patients who have underlying thyroid disease, that first trimester is the most important. So always make sure that you let your physician know as soon as you're pregnant that you have thyroid disease, because your dosing needs to be adjusted immediately, and that is going to help for safe, normal outcomes in a pregnancy.
She came with a diagnosis that I had hypothyroidism and Hashimoto disease, which sounds scarier than it is, but it's just you have to have thyroid medicine to bring up your thyroid. In order to be able to get pregnant, I had to have that fixed, which she did. So I went on common thyroid medicine, and I was on it for, I think, 2.5 months, and it brought my level up. And then I was able to do IVF, in which now I'm pregnant, so it worked.
So knowing that you have underlying thyroid disease, we'd like to make sure that everything goes well for those patients. And typically we have wonderful, perfect outcomes for those babies if they're treated appropriately during pregnancy.
Meeting Dr. Hands, it's definitely changed my life. If I hadn't come to her and had my thyroid checked, looked at everything, I would never be in this position. We would never have, be able to have our little girl. And so I don't think there's any other endocrinologists out that are like her that really takes a real personal interest into your life. And it's incredible. It's really, really nice to have somebody that looks out for you like that.